Hello students, so I'm Dr. Gayathri, your OBGyn faculty, and today we would be discussing about hypertensive disorders in pregnancy. So this will be a quick and crisp discussion by the end of which you will be able to differentiate the different types of hypertension, recognize the severe and non-severe symptoms and manage them accordingly. So let's jump into the topic. So let's deal with the various types of hypertension. So this includes gestational hypertension, preeclampsia, chronic hypertension and chronic hypertension with superimposed preeclampsia. Let's deal them one by one. First, we will discuss about gestational hypertension and chronic hypertension. So hypertension is when the systolic BP is more than or equal to 140 and the diastolic BP is more than or equal to 90. So in case of gestational hypertension, the high BP is diagnosed first in the pregnancy after 20 weeks and it comes back to normal within 12 weeks postpartum. Diagnosed after 20 weeks and comes back to normal within 12 weeks. Whereas in chronic hypertension, the high BP is diagnosed before 20 weeks or it does not come back to normal within 12 weeks. This is or. It is diagnosed before 20 weeks or it does not come back to normal within 12 weeks. Alright. Now let's see what is preeclampsia. So in a patient with gestational hypertension, if there is evidence of proteinuria or end organ damage, we call that as preeclampsia. Similarly, in a patient with chronic hypertension, if there is symptoms of proteinuria or end organ damage, we call them as chronic hypertension with superimposed preeclampsia. Alright, so now let's understand what is this proteinuria and end organ damage. So proteinuria can be assessed using 3 tests. This include the urine dipstick test, the 24-hour urine protein, which is actually very cumbersome and difficult, so the newer protein creatinine ratio. So in case of dipstick test, the test can be either trace 1 plus, 2 plus, 3 plus or 4 plus. So 1 plus is suggestive of a proteinuria which is equal to 0.3 gram per liter, that is 300 milligram per deciliter. When we do a 24-hour urine protein, if the proteinuria is more than 300 milligram per deciliter over a period of 24 hours, more than 300 over 24 hours, we call that as proteinuria. Similarly, while we are doing a protein creatinine ratio, if the ratio is more than 0.3, that is suggestive of proteinuria. Dipstick 1 plus, 24-hour urine protein 300 and the protein creatinine ratio of 0.3. Among this, dipstick is only performed while the other tests are not available. Alright, now coming to the end organ damage. Let's have a look at this diagram for easy remembering. Alright, so in this include either in the blood, the platelet count is less than 1 lakh per cubic millimeter or less than 1 lakh per microliter. Platelet count less than 1 lakh. Next is regarding the liver function test. The liver function tests are raised, that is, it is 2 times the normal. What is the normal value in pregnancy of SGOT and SGPT? It is 35. So twice is more than 70. If it is more than 70, it is deranged. So next is regarding the serum creatinine. Doubling of serum creatinine from the normal range or when it is more than 1.1. More than 1.1 or doubling, that is suggestive of the involvement of kidneys. Next is evidence of pulmonary edema. The cerebral symptoms could be convulsion, blurring of vision or headache. All these are suggestive of end organ damage. So all these types can be divided as non-severe or severe. There is no mild, moderate terms. It is either non-severe or severe. So how do we differentiate this? The first thing I want you to remember is proteinuria does not affect the severity. So proteinuria is out. What about the blood pressure? In severe, the systolic blood pressure is more than or equal to 160 and the diastolic blood pressure is more than or equal to 110. Whereas in case of non-severe, it is more than 140 but less than 160. Diastolic is more than 90 but less than 110. All right. Second is presence of evidence of end organ damage. We have discussed the various symptoms and signs of end organ damage previously. All right. Along with that, please remember oliguria as well. Oliguria is suggestive of affection of the kidney. So presence of oliguria would be again categorized as severe. The third is presence of impending signs and symptoms of eclampsia. This is also known as imminent signs of eclampsia. That means there is a high chance that the eclampsia can happen. What are these signs? This includes headache, blurring of vision, as well as right upper quadrant pain. Headache, blurring of vision, and right upper quadrant pain. Why does this right upper quadrant pain happen? This is mainly due to the stretching of the glycans capsule of the liver, which happens due to subcapsular hematoma. This could be also due to the necrosis as well as ischemia of the liver cells. All right. So the fourth thing is, if there is presence of intrauterine growth retardation, if there is IUGR, it is severe. If there is eclampsia as such, it is again severe. All right. The fifth thing is, if the period of gestation is very early, it is more pointing towards severe. So this is the table that I have taken from your latest edition of Williams, that is 26th edition of Williams. So we'll discuss the management in the next video. I will provide the link here. So until we meet next time, bye-bye.